Hello and welcome. Today we'll be exploring a fascinating yet often overlooked disease that can significantly impact the urinary system, ureteral schistosomiasis. Ureteral schistosomiasis is primarily caused by infection with parasitic worms of the genus Schistosoma, specifically Schistosoma hematobium. These worms are transmitted to humans through contact with fresh water that is contaminated with infected snails. The snails act as intermediate hosts for the parasite. When people wade, swim, or wash in these waters, the larval form of the parasite, called Cercaria, penetrates the skin, initiating the infection. Once inside the body, the Cercaria transform into schistosomuli, which then migrate through the bloodstream to the liver, where they mature into adult worms. The adult Schistosoma hematobium worms then migrate to the blood vessels surrounding the bladder and ureters. Here, the female worms lay their eggs. Many of these eggs are excreted in the urine, completing the parasite's life cycle. However, a significant number of eggs become trapped in the tissues of the bladder and ureter walls. These trapped eggs trigger a chronic inflammatory response, leading to granuloma formation, fibrosis, and ultimately damage to the ureteral walls. This can result in ureteral thickening, narrowing S stricture, hydroureter, dilation of the ureter, and hydronephrosis, dilation of the kidney due to backflow of urine. Schistosomiasis, in general, is prevalent in many tropical and subtropical regions, particularly in Africa, the Middle East, and parts of South America and Asia. Ureteral involvement is a common manifestation of Schistosoma hematobium infection, making it a significant public health concern in these endemic areas. Risk factors include living in or traveling to these regions, especially if engaging in activities involving contact with freshwater sources known to be contaminated. The signs and symptoms of ureteral schistosomiasis can vary depending on the severity of the infection and the extent of ureteral damage. Common symptoms include hematuria, which is blood in the urine, dysuria, or painful urination, frequent urination, and abdominal or flank pain. In more advanced cases, ureteral obstruction can lead to hydronephrosis, which can manifest as back pain, recurrent urinary tract infections, and even kidney damage. Some individuals may remain asymptomatic for extended periods, making early detection challenging. Diagnosis of ureteral schistosomiasis typically involves a combination of methods. Microscopic examination of urine samples to detect Schistosoma hematobium eggs is a primary diagnostic tool. However, egg excretion can be intermittent, so multiple samples may be necessary. Imaging techniques, such as ultrasound, intravenous pyelography, IVP, and CT scans, are crucial for assessing the extent of ureteral damage, including thickening, dilation, and hydronephrosis. Cystoscopy, a procedure involving the insertion of a thin, flexible tube with a camera into the bladder, can provide direct visualization of the bladder and ureteral orifices, allowing for biopsy of suspicious lesions. Serological tests that detect antibodies against schistosoma can also be helpful, particularly in early or light infections. While there are no specific classifications for the types of ureteral schistosomiasis itself, the severity of ureteral involvement can be graded based on imaging findings. For example, the degree of hydroureter and hydronephrosis, as well as the presence and extent of ureteral strictures, can be used to assess the severity of the disease and guide treatment decisions. It is more appropriate to consider it as a part of the disease progression rather than distinct types. The primary treatment for ureteral schistosomiasis is medication to kill the schistosoma parasites. Praziquantel is the drug of choice and is highly effective. In cases of severe ureteral obstruction, surgical intervention may be necessary. Procedures such as ureteral reimplantation, ureteroplasty, repair of the ureter, or even nephrectomy, a removal of the kidney, may be required to relieve obstruction and preserve kidney function. Management also includes addressing any secondary complications, such as urinary tract infections, with appropriate antibiotics. Regular follow-up is essential to monitor for recurrence of infection and progression of ureteral damage. Prevention of schistosomiasis relies heavily on public health measures aimed at reducing exposure to contaminated water. This includes improving sanitation and hygiene practices, providing access to safe water sources, educating communities about the risks of schistosomiasis, and controlling snail populations through molluscicides. Mass drug administration programs, where praziquantel is given to entire communities at risk, are also effective in reducing the prevalence of the disease. With prompt diagnosis and treatment, the prognosis for ureteral schistosomiasis is generally good. However, delayed diagnosis and treatment can lead to irreversible ureteral damage and kidney failure. Recent research is focusing on developing more sensitive diagnostic tools, including molecular techniques for detecting parasite DNA in urine. There's also ongoing research into the development of a vaccine against schistosomiasis, which would be a game changer in preventing this debilitating disease. Thank you for joining us for this discussion. We hope you found it informative.